Yeah.
Josh, we are ready. So, Jess, patient assessment medical for a possible stroke. You have 15 minutes to complete this skill sheet.
Okay. BSI, is my scene safe?
Yeah, sorry, you were dispatched to Walmart for a person acting strange.
Okay. BSI, is my scene safe?
Yeah, your scene is safe.
Is this my only patient?
It is your only patient.
All right. I'm gonna consider additional EMS resources, but I don't think I need any at this time.
Okay.
And I'm going to consider C-spine for my patient.
Okay.
So I'm gonna approach the patient and introduce myself. What do I get back from the patient?
So the patient, you find him sitting on a bench. He looks at you.
Mm-hmm.
Tries to speak. Wrong words come out.
Okay. At this time, my patient is responsive. My general impression of the patient is poor. It's clear some sort of neurological deficit of some sort. I'm going to assess the patient for any life threats. Do I see any bleeding or anything that needs to be taken care of right now?
No life threats are noted.
Okay. And I'm going to start check my airway. Is his airway patent?
Yep, it's patent.
Okay.
He's moving good air.
Moving good air. How's breathing? Is it good, equal, bilateral expansion?
Yeah, it's normal rate, unremarkable, bilateral, chest rise and fall.
Okay. I'm going to check the skin color, temperature, condition, and pulse.
He is pink, warm, and dry.
Pink, warm, and dry.
And pulse is 80 regular.
80 regular. All right. Due to the neurological deficit, I'm going to say this is a high priority patient. We should probably be a rapid transport and get going.
Okay.
And so I'm going to now try to obtain a sample history and OPQRST. Starting with OPQRST.
OPQ's onset, his wife was there.
Okay.
Onset has been 15 minutes. They were walking around doing their shopping.
Mm-hmm.
He started talking funny, kind of walking around funny. He seemed really dizzy.
Okay.
He hasn't been dizzy or anything like that. He's still talking funny on the bench. He's not in any pain. The quality is altered mental status in the time. What has been now 15 minutes.
15 minutes. Okay.
Is there anything else you would like to know?
For sample history, I'd like to know if the patient has a history of anything like this in the past, strokes, any cardiovascular problems, anything like that.
He's had a heart attack in the past, but it's been over 15 years.
15 years, okay.
He's allergic to shellfish, and he takes blood pressure medicine.
Okay. All right. I'm going to go ahead and get full set of vitals, blood pressure. What's the patient's blood pressure?
Blood pressure is 130 over 90.
130 over 90. Okay. Pulse, you said was 80. And,
Yep.
Respirations, what do I have for respiration?
16.
16. Okay. I'm going to go ahead and get a blood sugar on this patient.
It is 100.
And SpO2 reading.
98% room air.
Okay. All right. So at this time, I'm going to state my field impression of this patient as a potential stroke. We're going to go ahead and do a Cincinnati stroke scale.
Okay.
Do I see any positives in the stroke scale?
Yeah, his grip strength is unequal. He has facial droop and slurring on the right side.
Okay, so this will be a stroke alert, and I'm going to say this is rapid transport. We need to take the patient to the appropriate facility. At this time, I do want to get an EKG and go ahead and treatment would be IV, and we would be and rapid transport. I'd be prepared to for an advanced airway to intubate the patient, and I would reassess the patient's vitals, and that would be, yep, that's all I have for this patient.
Okay. For the closest appropriate facility, you have a facility, a community access facility with imaging that is 15 minutes away, or you have the stroke center that is 40 minutes away. Which one are you going to pick?
I would choose a stroke center.
Stroke center. Anything else you'd like to add?
Just gonna clarify, I'd reassess all my interventions and vital signs every 5 minutes, and just rapid transport and prepared to intubate it at the moment's notice.
Cool.